Hello there and welcome to, we're coming to you live from our studios here in Kokomlimle on digital address GA099242539. Our lead stories this hour. Mass disregard for COVID-19 protocols, especially by students returning to school less than 24 hours after President Akufo-Addo announces security clampdown on flouters of the rules. We go to schools across the country and talk to stakeholders in the education chain to find out how else these students can be made to observe the protocols. And the debate on the cause of spread of COVID-19. Government lists Christmas and New Year festivities, rejecting political campaigns, voter registration and elections. We hear a contrasting view from former Chief Justice Sophia Ekufu, who is now chairperson of the COVID Fund Board of Trustees. Also coming up, 2 years since the murder of investigative journalist Ahmed Swale, the Ghana Journalists Association rolls out a campaign in his honor as journalists explore how to stay better protected. The Pulse is brought to you by Global Communities Dignilu, affordable safe sanitation. Join us on DSTV 421, GoTV 144. We're streaming live on YouTube and our social media handles. So send your WhatsApp messages to 0540-109009. My name is Gifty Andopia. This is The Pulse. Please be my guest. You're welcome to the show. Let me take you through the details now. On the streets of our cities, there are many people still disregarding the COVID-19 safety protocols, especially the wearing of face masks and social distancing, contrary to the president's directive. Persons violating the protocols risk fines up to 60,000 Ghana cedis simply for refusing or failing to wear the mask in public places. A jail term of up to 10 years also awaits such persons if they cannot pay the hefty fines. Last night, President Akufo-Addo announced a step up in enforcement as cases begin to rise at a rather fast rate.
14 persons are said to have died from COVID-19 in the last 2 weeks alone. President Akufo-Addo says the country's situation is worsening by the day.
2 weeks ago, there was no critical case. We now have 33 in our treatment facilities. At this current rate, whereby 13 out of the 16 regions have recorded active cases, our health infrastructure will be overwhelmed if the situation continues. It will severely undermine the efforts government is making to revitalize the economy and put our nation back onto the path of progress and prosperity following the ravages of the pandemic.
The president also disclosed majority of persons contracting the virus have been found to have ignored the COVID-19 safety protocols and said security personnel are being deployed across the country to enforce compliance.
Again, according to statistics from the Ghana Health Service, the considerable number of persons who are severely ill are surprisingly relatively youthful persons with no previous underlying health conditions. The number of confirmed deaths has increased sadly from 338 persons to 352 within the period. It is my duty to protect lives and livelihoods. In furtherance of this, I've instructed the Inspector General of Police to direct officers, men and women of the police service to ensure the rigorous enforcement of the law on mask wearing at all public places and in public transport. They're also to ensure the closure of all nightclubs, pubs, cinemas and beaches that may be operating in defiance of the law. They will be assisted by the other security agencies, if need be. Persons in marketplaces, workplaces, and operators of public transport must conduct their activities in accordance with the hygiene and safety protocols. The wearing of masks in these places is mandatory. Regulatory agencies will undertake random checks to ensure conformity with COVID-19 rules. Should any facility or institution fail to comply with these directives, its activities will be immediately prohibited and appropriate sanctions applied. It is important that I remind all Ghanaians that severe punishments exist on our statute books for persons breaking the law on the mandatory wearing of masks.
He also disclosed that Ghana has recorded cases of the new strain of COVID-19.
Recent genomic sequencing undertaken by our scientists have established that some arriving passengers tested positive for new variants of COVID-19. These passengers have all been isolated. Furthermore, work is ongoing to determine the presence and extent of spread of the new variants in the general population.
The president also said, as part of the reopening of schools on Monday, government is undertaking measures to ensure children are safe.
Our children in kindergarten, primary, junior high school, SHS2 and SHS3 resume school from tomorrow. I wish to reiterate the government has taken the required steps to ensure their safety in school. Heads of institutions, as well as their teachers, have undergone the requisite orientation on guidelines for school reopening during COVID-19 to enable them assist with compliance of students with the protocol. As we take these big steps to go back to school, your attitude, your behavior, your self-discipline will decide whether or not our schools will remain open. I'm pleading with you. Please observe the COVID-19 protocols at all times. You must maintain the level of discipline and sense of responsibility to stop the virus from spreading in your schools and for those students at home as well.
Now, that was President Akufo-Addo last night announcing that there are new variants, and so government intends to take a more stricter position on ensuring that we all wear the masks. Well, while the police prepares for the deployment, there is total disregard for the protocols across the country. In the Central Business District of Accra, not many have respected the protocols. This afternoon, we checked from the regions on how these protocols are being observed and rolled out even. We start from the Volta region. Director of Health, Dr. Senanu Jokuto, is joining me via Zoom. Hello, Doc. Good afternoon.
Listeners, but let me make this quick correction. I'm the Deputy Director of Health.
Right.
In charge of public health, and I'm speaking on behalf of my Regional Director of Health Services, who is Dr. Timothy Lecture.
Very well. Thank you very much for that correction. Let's find out how the Volta region is looking like in terms of your case management. How many do you have so far?
At present, we have 37 cases.
Okay.
And if you compare it to 2 or 3 weeks ago, where we had 0 cases in most instances, then you can actually say that in comparison to the national picture, it is very similar. We have seen an upsurge of COVID-19 cases in the past 2 weeks. To move from 0 to 37 is quite significant. And in the last week as well, we have also lost 1 patient due to COVID-19. And you would have noticed that in the past 12 months, we have had 12 mortalities. So if within a week we have lost a patient in this current upsurge, then that also is cause for concern.
We understand that this happens to be the very first death recorded in the region, but we need to clarify this. How sure are we that it is?
During this particular surge, this is the first mortality that we have recorded.
As in this particular one
in the past 2 weeks.
All right.
But we have a total of 12 mortalities since we recorded our first case on the 12th of April.
Okay, so if you put all together, you have about 12 mortalities since it started in March, and since you recorded yours in April. But in the past 2 weeks that the cases have surged from 0 to 37, this is the very first death.
This is the first mortality. So in total, the Volta region has 13 mortalities now.
How is the outlook as we speak? Yesterday, President Akufo-Addo spoke about enforcing strictly the wearing of masks. The last time I spoke to our correspondent in the region, people were simply disregarding that rule. Has the president's announcement last night changed anything from your perspective?
The president's announcement last night has given us the required impetus. Risk communication is something that has been ongoing, but usually when they hear it from a higher source, they tend to wake up. Okay. So this morning, what has dominated the airwaves has been adherence to protocol, and it has really helped. And it has trickled down. Obviously, we take a cue from headquarters. The instructions they've given have trickled down all the way to the districts. So you've noticed that, for example, at the region, we've had our Regional Emergency Operations Center meeting on how to re-strategize so that we actually respond appropriately to this COVID-19 pandemic. Also, we are meeting our stakeholders via the Regional Public Health Emergency Management Committee very soon. I'm sure it's by tomorrow. I know the invitations are already going out. There we have the police, we have the immigration, we have all the security agencies and all our partners who are required, Ghana Education Service, so that they are able to put in strategies to be able to overcome this particular challenge. Also, we are looking at the instance where the citizens themselves would notice that it is their own responsibility to ensure that they stay alive, so that they would actually begin adhering to protocols even before enforcement comes in from the police. So yes, the president's announcement yesterday has renewed the energy to fight COVID-19 as we speak in the Volta region.
Regarding the reopening of schools, what has your outfit observed, and what plan do you have to correct? And I'm saying correct because I assume that it hasn't been the best. It hasn't been up to expectation. The children going back to school. So, what are the steps your outfit is taking to correct what we're all seeing as still disregard for the protocols?
We have been tested in this regard. If you may recollect, a number of months ago, secondary schools were reopened for the final years to come and write the exams. SS2 also came in to write the exams. Universities have also come in and written their final exams. So during that process, we collaborated very well with the Ghana Education Service, and we put in place all the required mechanisms to ensure that all the students are safe. So this is on a larger scale. What we have done is to also reactivate the district task force that is monitoring all the schools to ensure that everybody is adhering to the protocols. So there are monitoring teams that have gone out today to see exactly what the schools are up to. But prior to that, we had mapped out all the schools and linked them to facilities so that if the need arises for them to receive care, they will do so and get their care promptly.
All right, Doc, I'll say a very big thanks to you. This is a conversation I will continue to have, seeing as we have just started going back to school. I'm sure we'll be dealing with the matters that arise. Dr. Senanu Jokoto there is the Deputy Director of Health in charge of public health in the Volta region there, helping us with the situation there. I'm taking you now to the Central Business District here in Accra, where not many have respect for the protocols. Kweku Asante was in town today to observe. He's joining me via Zoom with what he found. Kweku, what did you see?
Right, so in Accra Central today, you see a number of people going about their normal duties in town without the face covering and without the requisite other face shield or the mask and all. And so most of them were not paying much attention to these protocols that the president has outlined. And yesterday in the president's speech, he said a lot of things about ensuring that there's compliance to all these and the directives. And so there was none of that in town today. And one curious thing is,
speaking of which, Kweku,
out of the Accra Business District, and there were very little policemen in town, or you will not see policemen going about trying to check these people whether or not they are observing these protocols. And so that was one bit of a surprising thing for me, right around the AMA to Tema Station, right into the to-do part, closely even to the Greater Accra region office of the police, and there are very little policemen inside trying to enforce these protocols.
Did you get a chance to interact with any of them to figure out whether or not they heard President Akufo-Addo and what they make of what he said vis-a-vis their behavior this morning?
Right. So towards the Accra Polytechnic, the Accra Technical University entrance, I spoke with some students, and that school has just reopened, and a number of them were undertaking their registration to be able to start their academic year. And I spoke with a few of them, and some of them had either not listened to the president, some of them had said they had heard what the president had said, but they probably were just not interested in putting on the mask. Most of them, if not all, did not have any reasons for which reason they were not wearing the mask or at least any face shield. They were just going about their normal duties without the mask. And you could see that there's a little bit of fatigue with the people in terms of how they will comply with the protective measures that have been outlined by government, and to which yesterday the president spoke and said that we'll be expecting that the members of the Ghana Police Service will be deployed to enforce this rule.
Kweku, thank you very much. Kweku Asante there, he was out and about today, checking for us whether or not the president's words have changed people's attitude. Early days yet, I would say. We'll see how it goes as we go along. But let me bring you back a story that we aired last week. Our head of health desk here, Fred Smith, was in town to find out what will get people to comply with the protocols. Here is what he found.
On the streets of Accra and other cities across the country, many are going about their normal activities without face covering. The few who have masks are either keeping them in their bags, pockets, or not wearing them properly. Some, like this woman, attribute this to the bad example showed by the country's political leaders on national TV. In March 2020, when President Akufo-Addo imposed a lockdown in Greater Accra, Kumasi and contiguous districts, compliance to COVID-19 protocols was high. Police officers would routinely stop and question those not in masks, whilst authorities deployed task forces to the central business districts to ensure compliance of the no mask, no entry policy. At this time, the country's case count was just 141 with 5 deaths. Today, there are more than 55,000 confirmed cases, 1,200 of them active, 44 severe and 338 deaths. But this is when Ghanaians are being reckless about the disease. Several weeks of electioneering campaigns, Christmas and New Year celebrations have contributed to the rising cases.
I would say 10 days ago that we started having slightly higher cases than discharges. So if you have more cases than discharges, then it tells you that you are going to have an increase in active cases. So I would say that over the past 1 week, there's an increase in number of cases. Government is already procuring vaccines, but this will not be enough to vaccinate everyone and won't even arrive until at least March 2021. The Ghana Medical Association has confirmed the country's treatment facilities are stretched following an increase in symptomatic cases.
As a country, gradually, we are going to slip as far as COVID-19 is concerned. The situation is that, one, enforcement is not happening at any levels whatsoever. Over the Christmas period till now, I have had calls from over 20 different families who have had COVID one way or the other. And some of them, you talk to them, the system has not even reached out to them to see whether, one, they are doing well or what is happening to them in the first place. Okay. And these are people, per the structure we are running, are supposed to be known to the system. They are doctors or healthcare professionals who will be mapped to these patients to oversee their care, even where they are receiving care at home, i.e. outside the care centers or the hospitals.
Some Ghanaians we spoke to want security personnel deployed to enforce the protocols.
Well, security agents are around, so they should be around to make sure that others are wearing it. I was not wearing the mask and I went to pass in front of the Ghana police headquarters. Okay. But when I saw the policeman standing there, I wore it. Okay, so as you said, the security agencies, if for instance, let's say as we were coming inside, there's a policeman over there ensuring that people wear their nose mask. My brother was not wearing it, unfortunately. So like you'll be told to wear it even before he enters this place. So as you said, I think that's what is best to be done.
When it started, they actually said that the police should be the ones enforcing the wearing of nose masks. Now they don't also care. They don't wear it first of all, and they don't also even care.
With new variants spreading like wildfire, everyone would have to take personal responsibility before the security agencies are deployed to compel us. Fred Smith for JoyNews.
And that was a report we put together last week. You can tell the story is not very different. If you flip the script, it looks pretty much like it was done today. Well, I'll take you to the Central Region where Dr. Godfrey Sapong, who is the Deputy Central Regional Director of Health, has been speaking to our correspondent, Richard Kujonyakun, on compliance levels there.
Currently in the Central Region, we have 2,000 cumulatively. We have 2,212 cases, and this is taking it from the 8th of April when we first had our first case to date. 2,212, and our active case count currently is at 47. Majority of them, I think about 36 are in home management and 11 are in our treatment centers.
How well are these people that are in the treatment centers doing? Are their conditions critical? Or?
Well, majority of them are in moderate, they are moderately ill. I think about 3 of them are critical. 3 or 4 are critical. The thinking you get and the impression you form when you walk through town, you go to the supermarkets, you go to our beaches, you go to the bars, go to churches, sit in our public transport system, is that COVID is no more, And sometimes you hear this from really people who should not be talking the way they are talking. Now, for some reason in Ghana, the disease doesn't kill, and that is just a common cold. And some even go to the extent of saying that, it's a horse and that, we should just go back to our lives, and forget about this face mask and the rest of it. And I think that's quite unfortunate. It appears that we've all gone to sleep, as far as the compliance with COVID-19 protocols are concerned. And that's quite disturbing, really disturbing.
The schools have reopened.
The schools also have COVID teams. All schools are enjoined to have COVID teams made up of management and the student body to ensure that on the school campuses and the compounds, COVID-19 safety protocols are observed. And then the schools also have infirmaries and sick bays. We've tasked the nurses working in the sick bays and the school infirmary. So work with the school COVID teams and the school management to ensure that we communicate correctly on the risk of contracting COVID-19, the symptoms and what to do should you suspect you have COVID-19 while you're on campus or you're in your house. And we are also reaching out to guardians to be on the lookout. Watch your wards and watch your children when they come home. Ask about the symptoms, ask about how they're feeling, and should you suspect it, also know where to go. Go to the appropriate health facilities and ensure that you report it, and then we take it from there.
There are some parents, finally. So there are some who, when you meet them, oh, I don't have, and all of that, in spite of the fact that this is just one CD or something. Do you have...
Richard, let's face it, people are not used to wearing a face mask, and they give all sort of reasons. It's uncomfortable wearing the face mask consistently wherever you go. It's uncomfortable talking through the face mask. I mean, sometimes you need some fresh air to breathe, as if when you're wearing a face mask, you don't breathe air. It's not something I think traditionally we are used to, until COVID came in. And what is making the situation worse is that, yes, we started so well, getting periodic updates on COVID. The media space was ablaze with education, and information on the updates of COVID. But I think that somewhere in the line we all went to sleep. We spiraled downwards, and it affected the compliance with the safety protocols. It's something that we have to deliberately, consciously, make an effort to do regularly. And I think that this is where the education should go. And the teaching staff, as well as management, ensure that COVID-19 safety protocols are enforced, they are taught to students, they are encouraged in all classrooms and halls.
Dr. Sapon there speaking to my colleague Richard Kojo Nyakon, who will be joining me when I return from this break. We'll take a look at how the students are returning to school over there. Do stay with us. We'll also go across the country. You're welcome back to the show. Many thanks for staying with us. Now, JoyNews checks that some public schools across the country have shown widespread disregard for COVID-19 protocols as the schools reopened today. Our correspondent who have been monitoring students showing up in schools say some are coming in without the masks. In private schools, adherence to the protocols is relatively better. Richard Kojo Nyakon is joining us from the central region, where he has been engaging pupils in some of the schools that he visited. Well, before we get to Richard to talk to us more on what he's found out, let's take a look at what he has sent through.
Mask? Where's your mask? You didn't bring some, or it's in your pocket. Or why have you put your mask in the pocket? Wait. So where is your mask? It's in your pocket?
Yes, sir.
So why do you have your mask in your pocket? You have the mask, but it's in your pocket. Why? You want to be infected with coronavirus? Have you heard that some people have contracted coronavirus and they are in a hospital? Do you want to also go to the hospital? Okay, so put on your nose mask and let me see. Okay, good, fantastic. So those who do have the mask, put them on, okay? Where is your mask? You don't have? Why? Why don't you have your mask? You didn't have money to buy? But why? You forgot? Oh, why did you forget to bring your mask to school?
I woke up early, so I forgot it.
You forgot your mask? Okay, so learn to bring your mask to school always, all right? Let it always be with you, not only to school, but let it be always with you, all right? All right, thank you.
Well, you heard the public service that Richard Kojonyako was doing there. He's joining me right now via Zoom. Hello, Richard. I think you're muted.
Yes.
Okay.
I think you can.
I do hear you, and I mean, I can feel you with the public education that you had to do with these kids, but I can tell that this is rather a widespread problem, even in your region.
Yes, that is true. Even on the streets, out of 10 people you meet on the streets, it's only 2 people probably who might have their mask on. If you go to the market, even at the University of Cape Coast, where I am currently, immediately after lectures, yes, there is no mask, no entry. But immediately after the lectures, you see them, the adults as they are, they remove the mask, put them in their bags or in their pocket, and then they walk freely on the street as if there is nothing at stake. So it is not only these school pupils that this thing you would find with them. I visited about 10 schools today, and it is the private schools that you see the enforcement proper, because the parents who drive their kids to the schools, they have their mask on and all of that. Even when they even closed, the kindergarten, the nursery people, the class 1, 2 people, their masks were removed. So at that age, the enforcement was very difficult. But if you go to the upper classes, like the class I was in, class 6, when I entered, 2 people only had their mask on. So I decided to do the inquiry, and I saw that a lot of them had the mask, but they were in their pocket or they were in their bag. So it was very difficult for them to enforce. But in other schools as well, just as I spoke with the regional chairman of the Ghana National Association of Teachers, Dr. Isaac Owusu, he indicated that they have been waiting, the heads of schools have been waiting for the face mask from the Ministry and the Ghana Education Service, but they are not forthcoming. So let's take a listen to Dr. Isaac Owusu.
Around few schools this morning, what we've seen, particularly at the public basic school, it is not encouraging. Why am I saying so? If you look at the children that have come to school, if you take about 10 pupils or students, it is out of 1 or 2 that are with the nose mask, which is very unfortunate. I think the parents that have their wards at the public basic school are not helping matters, as well as the employer, that is the GES and the Ministry of Education, because schools have officially resumed today. But unfortunately, the GES has not been able to provide the PPEs for the schools. Likewise, the parents have also sat down without making provision of the PPEs before allowing their children to go to school. And we all know the risk at which we are all standing now. Teachers are not safe, the students are not safe. So coming to school to see that the children are not with the nose mask, I think it is not helping matters. So we will plead with the power that be to make sure that at least, as soon as possible, we should be able to get those things, at least before tomorrow, we can officially commence the school business. In fact, as I'm talking to you now, we've not been able to get the exact answers to the question that we are asking. You call this here, they will tell you the items are coming. You call this director, they will tell you yes, the items are coming. But when you ask the head teachers concerned, they will tell you they are also not getting answers to the question they are also asking. So we are only praying that at least maybe the week is still young, by the close of today, the schools will receive those PPEs to enable us to start on a good note tomorrow morning, God willing.
So what would you advise going forward? The teachers that are in the schools, some you see them wearing the mask, but their kids, the children they are going to teach are not wearing the mask at all.
Yes, that is the unfortunate situation we find ourselves in. But I think as teachers, we know how deadly this disease is. So we are also praying with our teachers to at least be extra careful in dealing with the students, because you know something happened last year when we allowed the SHS3 students to come to prepare them for Yawasi. Something happened at KNUSC Secondary School when the child was not feeling well. The teachers there were afraid to support the child, and unfortunately the child passed on. So we are telling our teachers that please, they should be very careful, because now that the children are not wearing the mask, we don't know what can happen to any of us.
So Richard, you spoke to him there, and he's hopeful that with time things would change, because for what happened today, it is nothing to write home about.
Yes, so that is what the indication is for him, and he says that when he asked the heads of the various basic schools, they kept on telling him that they said that the face masks were coming, but I mean, he visited the schools and then the face masks were not on. He said that they need to bring them in order for the teachers to be able to enforce that, because the teachers cannot sack the students who are coming without the face mask. It will be something out of order for them to be sacking the students when they do not have. Some of them will give excuses that their mothers or their parents did not have money to buy the face mask. That cost just 10 cedis in the central region.
I'm seeing some of the videos that you sent earlier, and I'm seeing children playing in the school. They're playing ampe, and we all know how we shout when we play ampe. None of them is wearing a face mask. Do you get the sense that these children understand what is happening?
Well, the education is very low. Gifty, yes. When I entered one of the classes, someone told me that the COVID-19 is an airborne disease. They seem to have some basic idea about the COVID-19, but they do not accept to live with the times that we are in. They want to be like the normal old school they were, where they will be playing their ampe, they will be doing their hide and seek, playing around and all of that without the nose. So the advent of the nose mask or the face mask is really problematic to them. One incident that happened today at Elmina, the Bright Light Academy, the parents sent their children to the school, and they were told by the proprietor of the school, it's a private school though, the proprietor told them that, well, I cannot no longer operate the school anymore. About 60 pupils, the parents were dejected, were frustrated, they didn't know what to do because there was no prior notice to them. The head said that, well, we cannot keep up with the protocols and the other things associated with it, so we better, collapse the school. And so they had to shed books of the pupils to the parents, and they had to take their children home. So they were dejected. We spoke with some of them, and they said that was unacceptable. So it is now that they are going to search or look for new schools for their wards. But the indication and the enforcement is really a difficult one.
Well, it was only yesterday President Akufo-Addo made that announcement. Let's see what the plan of the Ghana Police Service is going forward to enforcing this. Richard, thank you very much. Away from the central region, why don't we go to the Ashanti region, where some students in first and second cycle schools have yet to fully appreciate what we're talking about here as far as observing the COVID-19 safety protocols are concerned as schools reopen. In breach of social distancing protocols, the students walk to school holding conversations without their masks. And you know how children talk, screaming at each other. Anaya Jima has more in this report.
Most of the students are happy returning to school after several months of break due to COVID-19 pandemic. But these students walking to school are without their nose masks.
Where's your mask?
This is in my bag. It is in my bag.
So why aren't you wearing it on your way to school?
I intend buying the mask in school. I didn't get some to buy on my way. I will strictly adhere to all the protocols.
It is difficult for me to breathe in the mask, but I'll wear it. At the entrance of Bomsu School, some students stand at the entrance to enforce hand washing and the wearing of nose masks. Within the school compound, the protocols are observed. Veronica buckets are dotted across campus, but authorities will not allow the team to film. At American Dream Educational Complex, fears of parents were allayed after witnessing the measures in place for the safety of students.
I harbored some fear walking my child to school this morning. The president mentioned that cases continue to rise, so I was disturbed. But seeing the measures in place, I am satisfied.
Thermometer gun check that's how temperature no higher.
I think we have put in place measures that is going to take care of that. As far as monetary stuff is concerned, we making sure that we pay for whatever we are using as parents. And we've done our PTA virtual meeting on our platforms. On this Sunday, we are going to have a face-to-face PTA, meeting, and we are going to see how best we are going to, sustain this thing.
Protocols are strictly observed in classrooms at the Solid Rock of Ages International School at Bokrom. Classroom sizes have been reduced to between 20 and 25 to ensure social distancing in classrooms. Proprietor Isaac Bwedi wants government to extend support to private schools.
Some schools in other regions have been fumigated. I know they did some work in Kumasi, but here in the Bokrom circuit, most schools were not fumigated. So we had to do it ourselves, but some are unable to afford.
From Kumasi for JoyNews, Nana Ojima reporting.
We'll find out what the other side of the story is. Meanwhile, we'll take you up north, where students of the Kalpohine SDA in the Tamale metropolis have given several reasons why they think that the COVID-19 protocols in the school will be very difficult to adhere to. The students said the classrooms are limited and they are forced to sit together about 3 and 2 on a desk. Martina Bogri has been engaging some of them.
Since the time I came to school, I've not seen anyone wearing nose masks, especially the students. And government said that he will provide us with nose masks, and he has not given us the nose masks yet. So we are hoping that he provides us with the nose masks and the water, especially the water. When it comes to the washing hands and the sanitizer, we have to go to the communities to fetch water, and I won't come in. Pour it inside the containers before we can get water to wash our hands. So we are hoping that the government will provide us with the nose masks and the water and sanitizer. Yes. Fear because when we go to the community, some people are there that you don't know. And in order for us to get water, we'll ask them. And they can easily bribe you. And they can ruin your life forever. Allo awewoli talata. Allo awewoli talata.
To speak frankly, observing social distances will be a problem. So in order to keep these protocols, the government needs to provide us with buildings and most to the point, the furniture we are sitting on. Because there's not enough space to observe the social distances. We sit 3-3 in the class, and that's not what we should have been doing. We should have been sitting individually. So now that all the badges has come, if it was to be the shift by shift, just as we used to do, it was really great. Because there was enough space for everybody to sit individually. Now that they are all there, we are sitting 3-3. Social distancing is a problem. Hand sanitizing, for that one is good. But the face masks, some of them are complaining that they can't take too long in it. For maximum, it's only 6 hours. So after the 6 hours, they remove the nose masks and they feel comfortable. Just as you came, as we were taking the video, you saw that some were not putting on their nose masks. So that was just the cause. And the washing of the hands too, as you can see, the Verona buckets, there's no water in them. The school is not, there's not much water in the school. And the nearby houses too, we used to fetch water from them. And just within these 2 months, they also had a problem with their flow of water. And they complain that they don't have water. So anytime we go in for water, they say they don't have water. We come back. So for the washing of hands, it's really very scarce. Sanitizing is good. To speak on my side, I would emphasize more on it. because I can see that my school and the teachers are capable of it, but I can't speak for others. But to my own understanding, it would have been a good thing. I'll plead with the district assembly to try their best possibilities to get us buildings, and most to the point, furnitures. The buildings are more important because with furnitures and without building, we can't sit outside the class and learn. And also, water too is our problem. They need to offer us water, since that's what we'll be using to wash our hands. And also the sanitizers, they are there, but it seems they are going out of hand. So we plead with the district assembly and the government and people in authority to provide us this water and the buildings as well.
When the COVID-19 pandemic was out, we were asked as the second batches or the year 2s to come back to school to continue our studies. So now when we came, we could see that because we were few in the school, we were able to go on with the protocols that were given by the government, like the wearing of nose masks, the social distancing and the rest, because there were not enough students here. So because of that, students were filled in other of the classes, so we were small in number, which made it very easy for us to go on with the protocols. Now for the water, now that we've increased in the school, we could see that our Form 2s, because now we are now in Form 3, our Form 2s have added to us, which has made us large in number.
So some of the students of Kapohini's district assembly school there. Now, how do you think the police can get us all to conform? The number is 05401090009. I'll be talking to the Institute for Education Studies as well, what their perspective is as far as making sure that we all stick to the COVID-19 protocols. It's Executive Director Peter Enti there, who is joining us via Zoom. But let me just quickly, Peter, you're welcome, by the way, and thank you for your time and your patience.
Thank you.
Right. I'd just like to quickly speak to Martina, who just brought in that report. Martina, we're seeing these students, I mean, some of them are very well wearing their masks, but they're saying that looking at their class sizes and sitting on 3 on one desk, it will be very difficult for them to observe these protocols.
That's true. From what they are telling us, the furniture is small, and the class itself is also small. And so they are forced to crumple themselves in 2 or 3. And this, they say that some would wear the mask and protect others, but others may not. And so that is really affecting them. Now, one other critical issue that came out was the water. There's no water in most of these schools. And so they have the Veronica buckets, but there's no water for them to wash their hands and then observe the protocol. But in some other schools, they do not have the water, they don't have anything, and the students themselves are not wearing their mask. And if you go to the Matoria Primary School this morning, as I went there, not a single person was in the mask, except the teachers who were wearing the mask. All the students didn't have. And they gave reasons from, my mother said she'll buy it later, to I told my mother and she said nothing, and several other excuses. Now, their hope is that if government distributes, then they can have to wear. But if government does not give in within the next 2 days, it means that they would have to go to school without protection.
I'm seeing so many students walking and jumping around without masks. And when we went into the classroom, there was a picture of this group of people. Only one person was wearing the mask. Have the Education Directorate, or has the Education Directorate there given you any answers as to why these students do not have the PPEs that government has promised?
What I gather, yes, I'm told that they have received, they haven't received the full complement of the PPEs they are expected. They are left with the nose mask, and they are expecting that it will arrive today and it will go to the various districts. So as we speak now in the northern region, the face mask is yet to arrive as at the time I was speaking to the PRO.
Martina, thank you for that one. So it gives you an idea what we're looking at. We've been to the Volta region, we've been to the Central region, we've been to the Ashanti region. We are here in the Northern region, and you see that the situation is the same. That is why IFES, the Institute for Education Studies, is actually calling for a suspension of the reopening. And Peter will give us the reason why they think that we should suspend reopening of the schools now. But quickly in the Volta region, the Angloga District Director of Education, Yvonne Akpene Ame Bruce, says the inability of parents to cooperate with the directorate is making things really difficult for them there.
The fact is, on the part of the directorate, we have engaged the teachers and the heads, so they know what the protocol is all about. So as you rightly said, the teachers on their part are trying hard to make sure that the students and pupils wash their hands before they enter, they sanitize their hands before they get to the classrooms and then the libraries. But the difficulty we are facing is this. Yesterday, we were in 2 different groups. We went around the churches in the district so that we could go. And then we engaged the parents and the communities, as you see, that when their wards are leaving their sites for school, they should try as much as possible to give them the mask. Unfortunately, it seems they are not cooperating well with us. So when you see the students and the pupils, they are in the streets going to school in the morning, this morning, as I was moving around without the mask. What we have to still continue doing is that we still have to go into the communities.
Ivy, is this a widespread story you can tell in the Volta region?
Yes, so most schools in the Volta region have difficulties in trying to make sure that students
We'll try and reconnect with Ivy, see how widespread this problem is in the Volta region. But you heard the director there. Let me bring in I first. I have the Executive Director for the Institute of Education Studies, Peter Anti, joining us via Zoom. Now, I first has a position which they've made clear in a statement that they released on the 18th. Peter, thank you once again for your patience. In this statement, you're asking for the suspension of the reopening of basic schools. Is your suggestion strictly for basic schools? Hello, Peter.
Thank you very much, and good afternoon to your viewers. I have to make this point. One, we have been for the reopening of the schools since day one. And that is because we know the disadvantages of keeping the kids in the house. Again, we were expecting the Ghana Education Service to have learned from the partial reopening of the schools that was carried out during last year. And we were hoping that since we were even dealing with a smaller group of students, getting the PPEs to the school really delayed. And that is one of the findings that we had when we conducted our research. So we were thinking that they would have learned from the experiences that they have gathered during the partial reopening and would have sent the PPEs to the schools 2 weeks or 1 week before time. But unfortunately, we were told that the PPEs will get to the schools, and by the time school reopened today, every school would have their full complement of the PPEs. We decided to do some small cross-check using our various networks, and we realized that most of the schools, as has even indicated by your reporters, most of the schools across the length and breadth of the countries do not have the full complements of the PPEs. In some schools, they don't have at all. And some of them, those who have, it seems like they brought it from the house. That is why we are saying that, look, the Ghana Education Service and the Ministry of Education knew when schools will reopen. And if they knew when schools will reopen and they have sat down and have not been able to get the PPEs to the schools till now, then it means that they are not ready for the reopening of the school. So they should suspend the reopening for 1 or 2 or 3 weeks and make sure that all the schools in the country get the full complement of the PPEs before they ask the students to go back. Especially looking at the announcement made by the president yesterday that the COVID is on ascendancy, it's increasing. And the president urged all of us to comply with the COVID protocols. Now we reopen school today, and the students do not have these PPEs, and they have gathered in their numbers in the various schools. In some classes, they outnumber the number of desks in the classrooms. What are we doing? We are finding ways and means to spread the disease across the length and breadth of the country, and that is why we are thinking that if the Ghana Education Service is not ready to get these schools the needed PPEs, then they should suspend the reopening and wait till they are able to distribute these things to the districts, for the districts to forward it to the schools. Then they can ask the students to go to campus to pick their PPEs, and then we can all ensure the safety of the students and the teachers on campus.
How far are you willing to take this advocacy that you've just put in? I mean, we've seen the statement, government has a position, students have been at home for so long. Have you, if I should put it that way, engaged the Education Ministry, for example, with this suggestion? Maybe you could make sense to them better that way.
Yes, we have not engaged the Education Ministry. We have sent copies of this statement to the Ghana Education Service, hoping that they would look at it and then take the needed steps, because we cannot continue to keep the students on campus in that state. So we are hoping that they will look at it. We believe that they would forward it to the Ministry of Education. Of course, sent email copies to the ministry, specific directors at the ministry, and we are hoping that they will look at it. But how far are we willing to take this? We are planning to meet the authorities of the Ghana Education Service within the week. We are hoping that they will listen to us, and of course, they will line up their challenges. But we think that it's better for them to suspend the reopening, make sure all districts get the PPEs, and then they forward it to the schools before the students are asked to go back to campus. I think this is a point that is reasonable, and everybody would agree with that position.
Peter, thank you very much once again for your patience and your time. Peter Anti is Executive Director for the Institute for Education Studies there. Their position is that suspend the classes for now, provide the PPEs before you allow the students to go back to school. I'll take you to Wale Wale shortly, but some of you have been sending me some messages here. Let me take a quick one. This one says, good afternoon. You will be shocked to learn that at the Iron City Basic School in Galilea near Kaswa, the classrooms for KG, and we're talking about KG, that's kindergarten. He says KG through primary school to JHS are having enrollments between 9 to 8 pupils and 130 pupils per class. The classrooms are overpopulated, that the COVID-19 hygienic and social distancing protocols cannot be appropriately applied there. To add insult to injury, this message says, reliable information has said that GS director under whose jurisdiction the school is has shown unwillingness to run a shift system. I have friends and relatives in that school who are teachers and pupils. Now, I think that it's interesting that thank you for bringing this to the attention of the public, but maybe you should reach out to higher authorities in the neighborhood so that we can deal with this. 90 people in a class. That will be disastrous. This is coming from Josiah. He sends that in Accra. Well, you're hoping that we take our cameras to this school as well. Certainly, we'll put that on our radar. Let me take you to Wale Wale in the West Mamprose municipal capital of the Northeast region, where students are, of course, happy, like their other counterparts, to be back in school amidst a total disregard, by the way, for all COVID-19 protocols. Eliasu Tanko is our man there. Here is his report.
At Wale Wale, the West Mamprose municipal capital of the Northeast region, students were happy to be back amidst a total disregard for all COVID-19 protocols. Here at the Periga MA Primary, it was all excitement as the school children cleaned up their classrooms and prepared the school surrounding for lessons to start. But as clearly projected, only a handful of them came to school with masks. Most of the children seen on their way to school, especially those in KG and lower grades, were also without masks and sanitizers. These children getting aboard this tricycle were on their way to a private school in the town. I met these children also going to a public school at Periga. There are no masks. There are no masks. At the Nazure Primary School, same situation was observed.
It's aware. So whether the school gives or not, but the children themselves should have come on their nose masks. So once they are now arriving, we'll conduct assembly and find out why they are not in their nose masks. But I'll also find out from office and see if they have for the children, so that we'll come and distribute it for them. Because I understand there are some consignments in the office for the peoples. So I'll be going there in a moment from now to find out.
Authorities said children and teachers are to clean their environment and classroom today after close to a year break. But in certain schools such as Wale Wale MA and Model Girls at Kukwazugu, the teachers were yet to report, and only children were seen embarking on the cleanup duty all alone without any supervision.
Excited and very happy. 100% sure that we are happy because as being in the house, some don't learn again. As some of us learn, some doesn't learn because they think that school won't resume again.
Now for a long time, and some of us may forget things that we have learned, and we are boring. We are boring, so we are happy that we are back to school.
We are the year 3 students. We are going to write this very soon. If we don't come back to school, it won't be because that's November. We'll be writing our things.
I'm afraid that our government tried his best to give us some material we can use to protect ourselves, such as hand sanitizer, face masks, and other things.
That is Eliasu Tanko there with the situation in the northeast region. You can tell, flip the script and it's the same. Let me take you, some of the messages that have come through. This one is coming from Senior Suaka Desmond in Ahafo, teacher. I hope I got that right. He says, can you imagine what happened in my school today? The kindergarten kids thought that the sanitizer is a form of fresh drink. And I bet you if they were given the chance, they would have definitely drunk it. Well, I guess that's another problem coming up that ought to be looked at. It is not a drink, and we ought to let them know that it is not a drink. Well, all right, this is a very long one. This one is from Kintampo. Dr. Kwejo Yelaj in Kintampo North says, we should bring our cameras to Kintampo, Kintampo North Municipality. There is total disregard for the protocols. Thank you very much. This one says it's rather unfortunate that the people who should know better continue to disregard the safety protocols put in place. But we must blame ourselves and our duty bearers or citizens combined. Okay, must we blame ourselves or the duty bearers or all of us? However, it is incumbent on all of us to abide by the safety protocols to reduce the spread of the virus, which is deadly. Abdullah Abdul Razak, General, sends it from Tamale. Well, President Akufo-Addo has warned that government will be forced to put the country under another lockdown if we fail as a people to adhere to the COVID-19 preventive protocols. A number of the new cases recorded so far have presented unfamiliar symptoms, including waist pains and sudden deaths without any underlying health problems at all. The development is prompting fears Ghana could be harboring a new strain of the virus. If so, how come? Which of the strains are we dealing with? Listen to Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, speaking on the probe with Emefa Apau.
We've been doing sequencing periodically, and after the last time the president spoke, I think that was when November, we had not discovered any new strain apart from what we already had here. What we've done is that since the the president spoke last, and we decided that for those who are coming in, we will test them, quarantine them, isolate them, and sort of do a sequencing. And that's when we realized that among those we identified, some of them had the new strains. Now, so it is not that they have entered the country yet. What we are doing now is that we are now going to look at the general population again to see whether in all that there's been a leakage into the country. And I think that's when that comes in. We'll let you know. So what we have, the new sequence we have, is that we've done that for those who came in since the last 2 weeks, since we've been detaining them.
2 weeks ago.
That's what we have been testing. For those who are positive, we test them, do the sequencing. That is what we've discovered that. But now moving into the general population to see that now we have found it here. Now let's look at the general population, whether in all those periods we've had some new strains in the country. I'm sure that one comes, we will share with you.
But he's asking specifically how we take care of those who have the new strain. Like, is it different?
No, what
is there any
special?
special?
Is that once we isolate you, we keep you until you are negative. And so definitely you are not able to transmit the virus to anybody. But because the people have come in over a period, and also possibility that someone may have been negative at the time of testing but turns positive later, we need to look at the general population whether we've had some of such strains infecting into the country. And that's what we are going to do now. That's what we have started doing now.
It's surprising that we haven't started.
Oh, we've been doing a population-based screening long. I told you, as at even November, that was the last one that was done.
Yeah, but since we discovered this new strain.
Oh, this is 3 or so days ago.
Okay.
It takes a long, sequencing is not like a dipstick and you get the results. It's a whole process. So once the results have come in now, that's when we're moving to the next step.
Okay.
Now, how different or similar are the symptoms of the new variant? Dr. Yao Bediako is an immunologist at the West Africa Center for Cell Biology and Infectious Pathogens. He's telling us more.
So, for now, so far, all the variants, and this is not just in Ghana, all the variants that have so far been detected globally, none have been demonstrated to cause more severe disease. So it appears that, COVID, depending on who you are, in different people presents different. But so far, there is no evidence of a particular variant that causes more severe disease. Having said that, as I said, these two variants that have been identified recently, and that unfortunately we now have at least found at the airport, these have been shown to be more highly transmissible. So what that means is they are transmitted from person to person much more easily than the previous variant. So while they may not cause an individual to be more severely sick than the COVID the variants that were circulating previously, the number of people that a single infected person can infect if they have this new variant is significantly more. And so that means that, if in a household you had one infected person in the past, they may not, they will probably not infect that many people in the same house. But with this highly transmissible variant, the chances of more people in the household being infected is raised. The same for public transportation or in an office or in a crowded area. Now, if one person has that new variant, the likelihood of multiple people in their surroundings being infected is significantly increased. In fact, the UK variant is 70% more transmissible than the quote-unquote original strain. Well, I mean, scientifically, we are yet to fully understand what makes this virus more transmissible. Okay. But I would say that, yes, social distancing, yes, the virus may not necessarily travel further, although it may persist longer. We don't yet know why it is more transmissible. But certainly, the time required to become infected is probably less. So what I mean by that is if you are in contact with somebody who is infected, with the older variant, maybe, if you were there for 5 or 10 minutes, perhaps you would not be infected. With the new variant, that time is probably shorter. So whether wearing double masking, I think one mask typically, once again, masking is only really works when everybody is masking up. Because when you wear a mask, you're actually protecting those around you, not so much yourself. You require those around you to also wear masks to in turn protect you. So I think with masks, as much as we are being asked to wear them, without full compliance, it can actually, it can cause significant issues. So we need everybody. I think that's why the president in his address was stressing that mask wearing is mandatory. And that is because if you wear a mask, but your neighbor who is close to you does not wear a mask, you are actually not protected. And so I think we need to be sort of encouraging people around us to also wear masks. If you get into a car and the driver is not wearing a mask, get out of the car unless he's willing to wear a mask. We have to realize that just wearing a mask ourselves, it does not protect us unless the other people are also wearing.
As an immunologist, they're talking about the way that this new variant seems to work, shorter period within which one can get infected. You're still watching The Pulse with me. We'll take a very quick break. We still have a lot more coming up, including the former Chief Justice Sophia Akuffo, who has been speaking. She's been speaking about various things, including COVID-19, how we've managed it, and, well, how she believes we caused the spread. You're welcome back. Many thanks for staying with us. Now, Chairperson of the Board of Trustees for the National COVID-19 Trust Fund, Sophia Akuffo, has blamed political rallies, parties during Christmas and other super spreader events for the spike in Ghana's COVID-19 cases. The daily virus cases in the country have surged, taking the country's COVID-19 active cases to now 1,776 confirmed cases, with 341 people dying. Speaking exclusively with my colleague Latif Idris, Sophia Akuffo called on the Ghanaian population, particularly school-going children and their teachers, to adhere strictly to the protocols to stem the spread.
Must stay on. I think the only time the mask can go off during school time will be in the dining room. Even then, hopefully the schools have also made proper arrangements to keep the children safely distanced. So they haven't seen their friends for almost a year. No hugging. They can do a hug. Oh, and yes, and they can also do namaste. Because I don't even believe in the elbow thing, because they do say it should be arm's length, your arm and my arm length. So if my elbow can touch your elbow, you're too close. Let's not joke with this disease. Ghana, when bad situations persist for a while, and we start making jokes about it. This pandemic is no joking matter. The numbers are going rapidly up, because towards the end of the year, there were just too many super spreader events. So the children, the young people, they should decide that now it is hip, now it is in, now it is, what are their expressions? It's cool to keep your mask on. And when you wear the mask, you're masking your nose and your mouth. I like your mask. It keeps your nose properly covered, even when you're talking. Thank you. Because it's important to keep both the nose, because you breathe through the nose and you talk through the mouth. Teachers must also set an example, and they should wear their masks properly, and they should constantly monitoring the children, the washing of hands, the taking of temperatures, keeping an eye on those who suddenly look not too well, and everything.
Super spread events, maybe you can highlight on those so that we do not go back and lower our guards so that we get another hit.
The super spreaders, the rallies. I stopped watching TV when before the elections. I stopped watching because my heart will be jumping, because I just could, people are excited, they are together, they are not wearing masks, they are shouting. That's a super spreader. Parties are super spreaders. large gatherings without masks, people bunched together.
For instance, what we saw at the beaches.
Oh, yeah. You know, you think you're having fun, but for some people, it has become a death sentence.
Well, what else has she been talking about? She is upset about wild accusations by a member of parliament for Asawase Muntaka Mubarak that a Supreme Court judge offered to bribe an NDC member of parliament to vote for Professor Aaron Michael Quay during the election of Speaker for Ghana's 8th Parliament. The accusation by the MP, according to her, has defamed other innocent judges of the Supreme Court who have built reputations for themselves over the years. Speaking again with Latif Idris, Madame Akufo strongly refuted the accusation, describing the same as bizarre.
Well, I think they must be very upset. If I was still there, I'd be upset. I'm not there anymore, but I'm still upset at the very thought that that kind of accusation will be made. I don't like accusations like that. It's like throwing a bucket of dirty water at people and you were aiming at somebody, but you just threw it and it dirties up everybody. If it's true, be bold. If you're going to talk about it, if you're going to mention it, if you're going to bring it into the public domain, say everything that has to be said. You don't have to. I know of a Supreme Court judge. There are, how many of them now? Of them. There are 17 people you have defamed in that casual manner. But you're talking about only one person. So there are 16 people who have been wrongly done by. I have confirmation that the Chief Justice is looking into it and has written to the parliamentarian to make himself available to produce the facts. Yes.
Apart from this, what else do you expect to see from the Chief Justice going forward into this wild allegation?
There's nothing the Chief Justice can do beyond. Well, he can write a complaint to the Speaker. But that will be, it depends on his methodology. After the inquiry the judiciary wants to do, after that, then he can, if it's found out that it was not true, or the person never turned up, or the person was not able to substantiate the accusation, then he will write to the Speaker and demand something to be some disciplinary action to be taken against that person. You don't. The Lord doesn't give you the platform to be heard. Every word you say to be heard for you to use in a wanton manner, right? So that's it. I don't think it's true. I choose to believe it's not true. What was he supposed to be bribing the lady with?
That's the bribe was to get her to vote for Professor Mike or Aaron Michael Quay.
The right thing, no. What is the valuable consideration he's giving? What? Money?
They were going to support the education of her kids going forward.
Parliamentarian is to be supported by a justice of the Supreme Court.
Sophia Kufu is former Chief Justice. Away from that, 2 years after the gruesome murder of investigative journalist Ahmed Swale, the Ghana Journalists Association is urging the police service to do more to arrest the perpetrators or those involved in the crime. Ahmed Swale, an investigative journalist and a member of Anas Arimi Yao, Anas's Tiger Eye PI team, was murdered in Medina. And it's been 2 years already. Since his killing, no person has been arraigned, no one has been prosecuted. Today, the Ghana Journalists Association held a forum in his memory and urged the police to arrest the perpetrators. Kweku, my colleague Kweku Asante, was at the forum. Here's his report.
It was almost midnight when Ahmed Swale set off home after a family gathering, as they usually do. A few meters from where this sitting was held, 3 bullets were fired into Ahmed Swale's neck and chest. Ahmed Swale was an investigative journalist with Tiger Eye Private Investigations and was part of an undercover team that investigated bribery in the Ghana Football Association, which implicated then-President Kwesi Nyantakyi. His killing in January 2019 received international condemnation, with these bodies urging the police to take steps to arrest the perpetrators and prosecute them. Today, Tiger IPI and the Ghana Journalists Association marked 2 years since the killing of the journalist. According to President of the Ghana Journalists Association, Afil Moni, the police must do more to arrest the killers of Ahmed Swale. 2 years since the killing, no person has been prosecuted in connection with the murder, and the Ghana Journalists Association is calling on the powers that be to give maximum support to the police to arrest the killers.
Indeed, it is not within the bounds of possibility for Ahmed Swale, who was murdered in the most tragic circumstances, to be brought back to life. But we believe that it is within the bounds of capacity of the Ghana police and the law and order community as a whole to fish out the perpetrators and bring them to book. They have a track record of dealing with such matters. The professionalism, the urgent promptitude with which they have handled previous cases gives us hope that the Ghana police, backed by the political will from the highest office, can intensify the search for the killers of Ahmed Swale.
Afil Moni there, he is the GJA president. I'll take a very quick break here. And this is where we draw the curtain. Well, for me, there is more news at myjoyonline.com. I'll urge you to log on and share the link with your friends. My name is Gifty Ando Apia. Let's do this again tomorrow, shall we?